Thank you so much. I'm ready. Good morning, InnovatorMD community, Dr. Yuli, Dominique, Ruchi, Lavinia, everybody who's been involved in this. It's just a pleasure to be here. And good morning to esteemed judges. Yeah, I'm Shahram Yousefi. I'm a university professor. I'll talk to you about a personal story and how I ended up here and the journey over the past 2.5, 3 years. I will try my best to not get too heavy or scientific despite my background, and you will excuse me if that happens. I'll be talking to you about MeshAI. In order to talk about that, I just started a couple of questions. We don't have enough time to poll people. I typically poll people. It's really cool to hear what people think in the healthcare community. My question is, what is the largest budget item in US healthcare? Couple of seconds of thinking. It's $1 trillion. That's the hospital care component of it. And when you think about a hospital budget, what's the largest line item for the hospital? Again, not a surprise, it's the cost of people. About 34% is the cost of people that run healthcare today. Healthcare is a human-centric business, and it is going to stay that way despite AI and intelligence and machine learning. And it is surprising, or maybe not surprising, that is the most mismanaged component of healthcare, how we manage our people, how we support them, how we take care of them, how we schedule them. So that's my pain point. So what I want to talk about is collaborative clinician scheduling. This mismanagement of people is so bad that I truly believe we need a shift in paradigm. And that is why we have really embarked upon this journey of building MeshAI. Why do we do that? I'm a university professor in engineering for about 20 years now. I had nothing to do with healthcare, but I had a near fatal medical error that had to do with fatigue, that in return had to do with erroneous scheduling of staff. So that's how I got it started. The numbers that drive me, that's what started me. What drives me today, gets me up every morning and puts me to sleep every night. These are the painful numbers that I go through. 500,000 people that die in the US alone as a result of medical errors that have some component of fatigue in it. Look at the clinician side, just look at the physicians alone. 3 US physicians commit suicide every day. And that's a really, really nasty number to look at, given the shortage of staff and physicians. 63% of physicians are reported to be in burnout as we speak. And you look at 2022 numbers, I don't have precise 2023 numbers, 33% of nurses, for example, left the profession entirely as a result of hostile environments we're in. How do we begin to fix healthcare, this broken healthcare that we're in? We believe that it starts by empowering our clinicians again. If you look at the history over the past 60, 70 years, every index you look at, it really points to the same thing. Physicians are losing control, losing power, losing ownership when you look at healthcare. So how do we do that? One of the things that drives that, in my opinion, and that's our starting point, is that clinician scheduling is done 100% incorrectly. What we need for the future of scheduling is a 100% transparent and fair scheduling. That's the scheduling that we need today. And this is the scheduling that we need tomorrow when we're going to have a truly multimodal healthcare with telehealth, VR, AR, a hospital at home, home healthcare, all of that being combined and run by the same people. So you look at the research, both in Canada and US, some of the things that people are pointing to look at the challenges of healthcare are saving administrative times for people, for physicians, reducing burnout, really addressing that head on, improving patient experience, and saving lives and money through all of that. And these are the things that MeshAI directly or indirectly impacts. So what is MeshAI doing today? We looked at the most challenging problem in scheduling of staff, and that's that of physicians and residents, mostly in academic settings. And maybe that's the reason, if you look at the market today, the majority of them are using manual tools such as spreadsheets or using spreadsheets along with some other manual tools. A very, very small fraction are actually using any automation at all for that very complicated scheduling that happens. And this is from the nature, the mathematical nature of this problem. So what do we do? So what we have built over the past few years is a combination of web, iOS, Android apps, this trio that are packaged together for collaborative scheduling. We sell a SaaS subscription model, is monthly or annual, based on and price based on complexity, so unlimited users. It's also unique and lends itself to the market and ICP we serve. We do call scheduling and clinic scheduling really well for those who are very technical here. And we have just finished our block scheduling component, moving in a direction to be a single source of truth for that community before we go to the other HCPs. What makes us very, very unique is the fact that we can customize to even most complex scheduling challenges that other people can't accommodate. So that's our future, really being able to driver of multimodal healthcare in the future, so that when people say, when people say today EMR, the word that comes to a lot of people in healthcare is what? Epic, Cerner. That's what we want to be when people talk about scheduling of staff. That's where we're going. What makes us unique, differentiators compared to the others in the market, which is very, very crowded, is automation engine and thousands of rules we've built since 2015, first academically, and then after we launched the product out of my lab. Ability to do workflow customization for the ICP to the extent that is not possible anywhere else, and we do that at a scale. And really inventing what we call glass box scheduling that replaces black box scheduling, which is spreadsheets, Amoyans, and QGendas of the world, all the competitors. Our GTM traction success is very, very simple. We have done a Trojan horse method. We sell to individual units, and then we expand from there. We spend about $2,000 to get an account, and our LTV is about 18K. 85% of accounts we get are through referrals. So physicians talk about us. That's most of the demos we get. We have currently done 65 accounts that touch 86 hospitals in Canada and US. Our churn is practically zero. People don't leave us, which is something I'm very proud of. 100% revenue growth in the past 12 months and 120% growth in terms of healthcare teams we support. And we convert between 50 and 74% of demos if you look at 6 months or 8 weeks cycle. So in 8 week cycle, we actually convert half of the demos we do. Even our competitors are coming to us to use our engine. So that's one of the things that makes us also very proud. In terms of track record, we came first in Charm Health competition just a couple of months ago. The largest public health unit in Canada, in the capital of Canada, Ottawa, just adopted MeshAI as a scheduler for their staff. That includes also nurses, which shows we're also entering nurse environment. American Medical Women Association has picked MeshAI as a scheduler of choice because we impact equity, diversity, inclusion for women in healthcare, minorities in healthcare. So we're very, very proud of those. We're in some of the best hospitals from Stanford all the way to UHN in Canada. And we've been written by numerous media, more than 100 since 2021. The market we're looking at right now, ICP of physician resident fellow, is 120 million. These are very conservative calculations that I can share later on. But we're going, again, for a very conservative HCP market of $2.5 billion a year. And I'm not factoring the multimodality of healthcare, such as hospital at home. Our who, I'm a university professor for 20 years in engineering, more than 100 patents and papers in algorithms optimization. So when that happened to me, I thought that was my calling to bring all of that and manage the problem of really taking care of providers. My co-founder is a neuroscientist, Ph.D., turned full stack developer. He runs technology, Dr. Ethan Hemming. We're the two co-founders, and we have a network of 18 physicians behind us in terms of investors and supporters. We have put together a team of 20 people today that are MeshAI across all the functionalities. And we have an esteemed group of 8 advisors that run all sorts of complex systems or have run all sorts of complex systems in healthcare over the past 20 years. And we work with them very closely, 2 of them on technology and 6 of them on the clinician side. Our current ask is that we haven't raised, we have been driven very leanly by our customers, and I'm very proud of that. But we're opening a $500,000 KISS safe convertible note, very strategically, only with the type of investors that are going to help us with GTM and expansion, rapid expansion, so that we get to where we want to go faster. Really, what we're going to do with this money is that really increase sales and marketing, product build to become the 360, which is right now in our product plan 2024. We're already doing that faster. Integrations and partnerships, we have a significant demand queue for doing that with a bunch of products. And we're right now on our path for HIPAA type 2, HIPAA and SOC 2 type 2 compliance, which is very expensive, as you know. Our target this year is to actually hit profitability and 1 million ARR from 300,000 ARR where we are right now. And also, in terms of long-term plan, IPO is a dream. It's a super dream we have, but we want to go towards, yeah. So covers everything. If you want to join us in this journey, get in touch with us. We would love to talk to you.